How can I cope with chemotherapy for bladder health? Facing chemotherapy for bladder health can feel overwhelming, but understanding what to expect and how to manage side effects can make the journey easier. Chemotherapy drugs used for bladder cancer or other cancers sometimes irritate or damage the bladder and kidneys. This can lead to symptoms like burning or pain during urination, frequent urges to urinate, blood in the urine, or trouble emptying the bladder. Certain drugs such as cyclophosphamide and ifosfamide are known to be particularly toxic to the bladder lining and may increase the risk of inflammation or even secondary bladder cancer over time. Chemotherapy can also cause temporary changes in urine color or smell, which can be unsettling but are usually manageable. The first step in coping is to report any bladder-related symptoms to your healthcare provider as soon as they occur. Early detection allows your team to intervene promptly and prevent complications. Staying well hydrated is also important unless your doctor advises otherwise. Drinking plenty of fluids helps flush the bladder and can reduce irritation. Your medical team might prescribe medications to ease bladder discomfort or spasms, and they may suggest treatments to protect the bladder lining, especially if you are receiving chemotherapy directly into the bladder, known as intravesical therapy. Regular monitoring is key. Your doctor may recommend urine tests, imaging scans, or cystoscopy, which is an examination of the bladder with a small camera. These tests help detect any late effects of treatment, such as scarring, decreased bladder capacity, or narrowing of the urethra. Strengthening pelvic floor muscles through exercises can improve bladder control and reduce symptoms like leakage, which sometimes happen during or after treatment. Adjusting your lifestyle can also help. Avoid bladder irritants such as caffeine, alcohol, and spicy foods if they worsen your symptoms. Managing menopause-like symptoms caused by chemotherapy, like vaginal dryness, can reduce the risk of bladder infections. Since chemotherapy can make you more prone to urinary tract infections, prompt treatment with antibiotics is essential to prevent further bladder issues. Caring for your emotional well-being is equally important. Coping with the physical effects of chemotherapy on bladder health can be challenging, so consider seeking support from healthcare providers, counselors, or support groups that focus on bladder cancer survivorship. They can offer guidance, reassurance, and practical advice to help you navigate this process. Remember, every person's experience with chemotherapy is unique. Your healthcare team will tailor monitoring and symptom management strategies to your specific needs, aiming to preserve your bladder function and improve your quality of life during and after treatment. Staying vigilant, communicating openly with your medical team, and making lifestyle adjustments can help you manage side effects effectively and maintain your overall well-being. Always follow your healthcare provider's advice and seek personalized medical guidance to ensure the best possible outcome.